April 7th marks World Health Day, a day when the world comes together to reflect on the state of our health. And today, a stark reality stares us in the face. A new report from Apollo Hospitals reveals that millions of Indians are living with undiagnosed chronic conditions. And this report highlights a silent epidemic where millions are suffering without symptoms, underscoring the urgent need for preventative health care. The report has revealed that India is losing the battle against lifestyle diseases, with chronic conditions now striking alarmingly young populations. The alarming trend, these diseases are no longer just adult issues. They are now striking younger, affecting college students and even children. Apollo Hospitals Health of the Nation 2025 report, released on World Health Day, has exposed that a ticking time bomb of undiagnosed metabolic disorders, silent heart diseases, and nutritional deficiencies are affecting millions. India's health landscape is facing a perfect storm and a shift, more importantly. The latest Apollo report, analyzing 2.5 million preventative health screenings, shows 65% of Indians have fatty liver, with over half showing no abnormalities in standard blood tests. Even more alarming, 1 in 4 asymptomatic adults under 40 already are showing coronary calcium deposits. Early markers of heart disease, that is. The data paints a grim picture at this point of time of generational health decline. While 8% of primary school children are obese, jumps to 28% in college students. Shockingly, 19% of college goers have pre-hypertension, 2% show elevated blood sugar levels, conditions that traditionally affected only elderly adults. Now, women also face particularly stark risks that have been shown in this very report. Diabetes rates triple, post-menopause 14% to 40%, 86% of elderly women are battling obesity. Mental health is equally concerning. 6% showed depression symptoms and 1 in every 4 Indian today is at a high risk for sleep apnea. Doctors are saying that NCDs are now striking 20s and 30s age group. We are seeing heart diseases in people who have never smoked or drank. This report is a wake-up call. India's future workforce is metabolically compromised. While Apollo's AI-driven pro-health shows promise, experts urge immediate nationwide screening drives and stricter food industry regulation. The time is to act, and the time is now. Let's in fact speak to Dr. S. Chatterjee, Senior Consultant at the Internal Medicine Apollo Hospitals. Dr. Chatterjee, we're talking at a time, and let me tell you, I am talking at a time when in our very own family, have lost someone who's very close to me, very young, from a similar condition. A heart condition, no symptoms, no warnings at all. And it's just a sudden occurrence that we are seeing. And in today's time, we've seen such instances take place again and again. And that too, the alarming part of it is they're all under the age of 40.
Yeah, I would totally agree with you. This is an epidemic sort of a thing which is happening in the country. We fortunately do a lot of health checks in our hospital, and that was basically propagated by our hospital chairman, Dr. Pratap Reddy, which was started in this center in this country. And we do about 150 every day in our hospital itself. And we see how it unravels when we go through the reports. When they come for a routine check to us, they say, oh, we don't suffer from anything. And when we go through the reports and go and get into more deeper questioning, we find that all these people suffer from all the illnesses that you just recorded. That at a younger age group, they're all suffering from what we call as lifestyle diseases, or which are not communicable diseases. Earlier, we used to all suffer from communicable diseases, infectious diseases and all. It is more common nowadays to have metabolic diseases, heart diseases, obesity, mental disorders. These are all a lifestyle disease which has to be detected early. And that's why I think it's very important to have health checks done so that it can be detected early and we can fight it out early.
You know, while you mentioned that, it's quite important. We Indians, unfortunately, do not have this habit of going for routine checkups every year. And that is much needed because many of these diseases actually that we are talking about are non-communicable diseases. In fact, in India, we've always seen a trend since our population is so high, that communicable diseases have always been a major concern, one that we've even recently seen during the pandemic. But now we are talking about a major spike in non-communicable diseases. How are we looking at these trends, number one? And number two, how do we grapple with this entire challenge?
See, the trend obviously shows that these diseases are going up. We would never actually suspect a heart disease in a person who would come with chest pain to us at an age of 25, 30 years of age. But what we have found that even these people are suffering from heart disease. A few people have heart attacks, and as you said, they can die without any symptoms all of a sudden with the first heart attack. So it is, and as the studies come through, because Apollo is a pioneer in doing health checks, we see so many results that come through every day. It is, we would definitely recommend that all people, one is that we should have a good lifestyle. Everybody needs to have a good lifestyle, sleep well, exercise regularly, and then also at the same time go for checks reasonably regularly so that the diseases are picked up earlier. Half of the people would come to us and tell us, "Oh, sir, we don't suffer from any symptoms. We have no symptoms. How can we suffer with diabetes? How can we have hypertension? Or how can we have a coronary artery disease?" This is what we are basically trying to tell people, that unfortunately they are silent killers, and you may not know of these diseases unless and until you have visited a doctor. He has taken a proper detailed history and obviously is also evaluated at the same time. So I would insist that other than a good lifestyle change, we should also visit the doctor or a hospital periodically to get yourself checked so that all these diseases are picked up early, because there's nothing better than prevention is always better than cure.
Absolutely. Prevention is always better than cure. That is definitely a major takeaway and always has been. But, let's also talk about the vitamin D and vitamin B12 deficiency. I would say rather it's only in the recent times that people have come to realize that depression is also from a vitamin B12 deficiency. I, for my part, would say that yes, many that I have known who have tackled with depression, they have not known about this very deficiency being the cause, and sometimes being the cause behind this very challenge that the youth nowadays face. So, when we speak of depression, depression is another epidemic that we see in the rise amongst youth, and the problem is the early onset. Even students today are tackling with depression, and it's a conversation that started, I would say, somewhere during the pandemic. The stigma, the stereotypes about keeping it hush hush has finally started fading away. People have started talking about in the open, but much more needs to be done at the very grassroots level when we speak of mental health problems, and especially depression.
I would totally agree with you. Mental disease is something which is becoming very common. We nowadays, as you see, that suicides have become very common amongst the younger generation. It's also because of the stress that they are undergoing because of the difficult exams and the placements that they don't get. So suicide rates have gone up. It has become a very, very stressful place. The competition has increased dramatically from our times. So it is important that the mental health is given a lot of weightage, because we have all realized slowly. But yes, I would agree with you that you said that it has now become a more acceptable thing to go to a psychiatrist or discuss with a psychologist your problems. Earlier, it was always said, "Oh, why should we go to? We are not mad people that we should go to a psychiatrist." People have now realized that yes, it is something where it is not only that you have to be mad or something to go to a psychiatrist. You might discuss your problems with them. There are so many counselors who are available who can discuss it and solve it out for you. So it is important that the awareness increases in the population, and we and the government make an effort to make it realize to the people that it is not that psychiatrists are only meant for people who behave abnormally, but it is also meant for counseling you.
Dr. Chatterjee, here I would also want to ask you another question, which is with regards to mental health problems itself. What would your advice be to corporates out there? Because now we have seen, in fact, just in the recent past, we have seen several such suicide cases taking place. And also, more importantly, another problem that's been highlighted at this given point is the fact that the work environments have started adding on pressures. And this is at a time we are discussing this when we also see high expectations in terms of working hours under not so conducive work environments, I would say, not so healthy work environments, I would say. We are talking about 70-hour work weeks, and all of that has been in conversation in just the recent past. What would you have to say to the corporates out there as a warning that, youth will not be able to function for a long time if these trends continue?
I said that is very important, that it is basically a balance between how you work, how you take rest, and the lifestyle measures. If you are not taking care of your health, if you are not sleeping well, if you are not exercising regularly, you would in the very near future land up with all these non-communicable metabolic diseases, which is going to harm you. Your entire expectancy, your entire duration of your life when you could be fit, it becomes actually shorter. So it is not the number of hours. Even, see, you might work 70 hours a week, but your output may not be as good if you have not rested, if you have not slept. So it is important that you rest well. Your output will be much better in those 6 hours itself if you have rested well and you are at mental peace. If you are not at mental peace, you are not feeling good. If you are not healthy, your output would be less. So even the corporates need to look into it. There is only not the number of hours; it's the work environment, the workplace that is where you are working, the health of the people. They all are important if you need to have, or if you want to get a good output from the younger generation.